I'm Mayor Ron Nirenberg with County Commissioner Justin Rodriguez. We're joined tonight by Dr. Junda Wu, our Public Health Authority here in Bexar County, as well as Dr. and Reverend Kenneth Kemp, who will be talking a little bit about the vaccination process that he and his congregation have been through. And this is our COVID-19 update for the San Antonio community. Today's vaccination report shows that 995,047 individuals have received at least one dose of the COVID-19 vaccine, and 741,238 people have been fully vaccinated. We're very close to 1 million people in our community, and we can't wait to get there. We'll probably be there by Monday. 59.9% of our Bexar County population have received at least one dose, and 44.6% of the population are fully vaccinated, and that includes all eligible populations, so that's 12 and up. And a reminder that 12 and up can receive the Pfizer COVID vaccine. The Pfizer vaccine is the only vaccine approved at this time for 12 to 15-year-olds. You can receive that vaccination at our public health labs, and that includes the Alamo Dome, from noon to 8 p.m. Wednesday through Friday without an appointment. It's important to note that only locations providing the Pfizer vaccine can administer a vaccine to 12 to 18-year-olds. Consent from a parent or legal guardian is required for 12 to 15-year-olds. If you prefer to book an appointment, they are also available by booking at covid19.sanantonio.gov, or you can call 311. A reminder that as appointments become available, and they're plentiful at this point, you can subscribe to vaccine alerts by texting vaccine or vacuna to 55000. Let me turn it over to County Commissioner Justin Rodriguez for a county update.
Great. Thank you, Mayor, and good evening, everybody. As the Mayor mentioned, the numbers are looking much better with respect to overall vaccination rates at the county hospital, University Health. Over 443,000 now have been fully vaccinated, or excuse me, total doses 440,000, and about half of that, 212,000, fully vaccinated out at the Wonderland site. As the Mayor mentioned as well, the 12 to 15-year-olds just became eligible over the last week or so. University Health has administered to date a little over 5,360 first doses to that 12 to 15-year-old population. So those numbers are looking good. I think we have to keep in mind, too, that as the CDC changes their regulations, we know the governor has also come out with an order with respect to masks. There is going to be, a certain number of folks, certain population that are going to continue to wear masks. Let's continue to be respectful of that. Let's be compassionate. There'll be private businesses, I'm sure, that continue to require or ask patrons to wear masks, all in terms of safety and making sure that our population is being considerate of one another. So with that in mind, we do have, as the Mayor mentioned, someone who wears two hats. He's a reverend and a doctor, medical doctor, Reverend Dr. Kenneth Kemp from Antioch Baptist Church. And I'd like to pass it over to him to say a few words.
Thank you, Commissioner. Thank you, Mayor, for allowing us to have an opportunity to say something today. I want to encourage everybody, listen, go get those vaccines. It's extremely important. I want to congratulate our leaders for encouraging our community to get vaccinated, and now we're almost at 1 million people having been fully vaccinated. Almost, not quite there, but getting close. We need to do this to protect ourselves, to protect our families, and to protect our community. Listen, we've been involved in setting up or participating with Metro Health and setting up a pop-up clinic at our church. And we're going to have the second pop-up clinic at our church coming up this Sunday. That's how much we believe in this. And we get vaccinated, we can go to church, we can go visit grandchildren and children and family. And feel comfortable in what we're doing and knowing that we're safe. So I encourage you, everybody, to go get that vaccine.
Thank you very much, Reverend Kemp, and we are grateful to you and your congregation for hosting that pop-up clinic for vaccines. I guess a few weeks ago now. It was very successful. Looking forward to another successful clinic this weekend. I do want to turn now to our COVID-19 update. And tonight we were reporting 138 new cases of COVID-19, which brings the total to 221,603. The 7-day rolling average is now down to 138. But keep in mind, again, we are getting folks vaccinated, but the virus is still being transmitted, and again, about 138 people per day. So please continue to do your part. And the best thing you can do is, if you're not vaccinated, go get one. I do also want to report there is one new death today. Please keep their loved ones in your prayers this evening. We know we have lost too many of our friends and neighbors to this disease. Over in our hospitals, there continues to be a downturn in the hospital numbers, which we are grateful for. There are 154 patients with COVID-19 in local hospitals tonight. Over the last 24 hours, there were 17 new admissions. 48 patients are in the ICU, and 28 are on ventilators. So all very good numbers continuing to be reported out from our hospitals, and that tells you that we are continuing to bring this virus and the pandemic under control in Bexar County. As you know, we've been getting a lot of frequently asked questions to our Metro Health professionals, and we've been posing a question to them that we receive frequently every COVID update. And let me ask this one of Dr. Wu. And the question is, why should kids this age get vaccinated?
Thanks. And I think it's normal for parents to be worried. And for individual questions about children, your pediatrician is a great resource. From a public health perspective, number one, kids don't get really sick that often, but it can happen. And even children who don't have very many symptoms or don't have symptoms at all can have some hidden damage to their heart muscle, which is a reason that student athletes are recommended to go see a pediatrician before returning to play if they have COVID. And then from a societal perspective, children can transmit, so they can transmit to people in your household or to another child who lives in a household where there's somebody vulnerable. So it's a good for the community too.
Thank you, Dr. Wu. And for those of you who want to know how you can help a little bit more, we do need blood donations into the South Texas Blood and Tissue Center, so please consider a donation of blood at southtexasblood.org or call University Hospital to schedule your appointment for blood donation. Also want to remind you that if you are struggling through this pandemic, paying rent or mortgage, we still have our emergency housing assistance program available for you. You can call 311 for more information or go to covid19.sanantonio.gov. Also there, you will find information about our training program. If you're out of a job without an income and would like to train for jobs that are available today in our community while you receive a stipend to make ends meet, again, call 311 for more information or go to covid19.sanantonio.gov. If you know someone who hasn't gotten a vaccine, please remind them that there is plenty to go around. We need you to get vaccinated as soon as possible. Do it for yourself, do it for your family, and do it for San Antonio. With that, Dr. Wu, myself, the Commissioner, as well as Dr. Kemper are available for questions.
Mayor and Commissioner, how do you guys respond to the governor's executive order getting rid of masks?
I'll go first. I think that, again, it had no effect on what we were doing here in the community because there wasn't a mask mandate in place anyways. But unfortunately, what it does is continue to fuel the politics of mask wearing, whereas we should be focused on getting people vaccinated as quickly as possible. There is reason for people to continue to wear masks if they're not vaccinated, as we have heard from our local public health authorities as well as CDC, and we want to make sure that everyone in our community, as they've been doing since the beginning of this pandemic, continues to follow the science and the guidance of our public health professionals, not the politics of the day.
Yeah, and I would just agree with the mayor's sentiment. Look, we should not be politicizing something that has been recommended by public health professionals. There are folks out there who may have some medical conditions, may be immunodeficient, and may continue to want to wear masks. So, we're I think at a stage where we want to fast forward to getting back to normal. The reality is, I think it's better to take a cautious, more deliberate approach. And I think that's the way that we've done it at the local level, and I think we'll continue to advocate for.
And the reason we're asking these questions is because we spoke to the San Antonio Alliance, who represents teachers and staff, and for them, I'm going to quote them, and they say, it is the time to really look to our elected officials to stand up to the governor for our children in our communities to protect us from the decisions that the governor is making and putting our communities at risk? How do you give them peace of mind tonight?
Well, I think, number one, since now that 12 to 15-year age group, we need to make sure that those kids in particular are getting vaccinated. I think, we have somewhere around 120,000 in that eligible range here in Bexar County. We're probably at 10% of that population. So, look, I don't think anybody here wants more for the kids in the public schools, the private schools, to be safe in that environment. And so I think the message we would continue to send is, get vaccinated, be cautious about what you're doing. And, they need to know that we have certainly the kids' backs and the teachers' backs. I think we all want a somewhat normal return to school in August. And the only way to do that is to make sure they're getting vaccinated and taking care of themselves.
I would echo the commissioner's sentiments. And again, I would be very clear. People still have the choice, as they have done since he ended mask mandates last year, to do the right thing. And there is good reason, again, as the CDC has stated, to wear masks, and that is if you're not fully vaccinated. And we would encourage folks to continue to do that. And keep in mind, schools still have the authority, as they have had throughout the school year, up until I think June 4th or 5th, when most of them will be out of session anyways.
Well, for some school districts, the school session or the school year doesn't end until June 17th. Their worry is that after that, possibly even next year, these kids under 12 years old are not able to get vaccinated just yet. So that's their concern for teachers, staff, anybody at a school campus going forward.
Well, again, I think it would be very hard to speculate where this will be in terms of the vaccine eligibility and the vaccination rates and herd immunity, et cetera, in the fall semester. I mean, we are making good progress. We want to continue to make good progress. And as we've said before, we're going to continue to follow the health guidance, and that comes down from CDC, which has jurisdiction over this entire country, as well as our local public health authority.
Unfortunately, Dr. Wu, we've heard that COVID cases are declining. There's less people hospitalized, more people are getting vaccinated. So do you really believe that it's the right time to take the masks off?
I think I think just like with a lot of other health decisions that we make every day. I mean, so the short answer is it depends on the person. And at this point, people are just going to have to make that choice, right? Just like we make choices about, are we going to drive too fast, or was that too much alcohol to drive, or, decisions about eating, many other areas in our health we make in our lives. We make health decisions every day, right? So now people, we hope that people make the wise choices. People have the right to make bad choices about their own health, but we can protect ourselves by getting vaccinated.
Dr. Wu, does Metro Health have a stance on whether employers should require or incentivize vaccinations?
We do not have an official stance. We just our only stance is that we want as many people as possible to get vaccinated.
Is Metro Health able to trace how many people who were infected with the coronavirus have received a vaccine?
No. Not in any kind of time frame that would to answer that question. There is a way that data could eventually be sifted out, but it won't be anytime soon.
Commissioner Rodriguez, what is the current situation at the Freeman Coliseum regarding the housing of unaccompanied minors, and can you tell us how many minors are still there?
Yeah, there are, things are still running smoothly at the Freeman. We're down to less than 400 unaccompanied minors at the Freeman Coliseum. 362 was a number I received this afternoon. So they continue to place kids with family and sponsors, and they're, as you know, starting to wind down that operation a little bit towards the end of the month.
With the contract about to end, what will happen to the other children who have not been united with a sponsor?
So what I understand is there's already discussions with respect to that. There will be another facility somewhere within the state that whoever is remaining at that time will be transferred probably in the next couple of weeks. So they'll be maintained in a safe, secure environment, but in another city in Texas.
Has the county been advised whether the federal government will seek an additional contract here?
I understand they have not reached out to extend that contract, and I don't even believe the Freeman would have the capacity because of conflicts and dates to extend beyond the current 60-day contract.
Also, for the mayor and Commissioner Rodriguez, do you have a comment on claims that the Phil Collins artifacts of Alamo collection are fake?
I haven't seen anything to that effect, so I don't have any comments on that.
Yeah, I've not heard or seen that story either, so I wouldn't be able to comment on it.
Does anyone on the panel have any details about the El Rey Feo WellMed vaccination drive on Saturday?
So all of the vaccination sites are actually findable at covid19.sanantonio.gov. You can pull up a map, and it is on there. I saw it there earlier today. You can either look by map or just as a list.
Yeah, what I've got here is May 22nd at 2600 Southwest Military. That's a WellMed coordinated site, and I believe it's going to be the J&J vaccine that's administered.
When it comes to graduations, we know that schools will no longer, after June 5th, will no longer be able to mandate students to wear a mask. If they're being held at the Alamo Dome or any other stadium, what's going to be the protocol there? Will students be mandated to wear a mask?
Again, as the city facilities at this time are following the CDC guidance, so people who are not vaccinated are encouraged to wear masks, and we believe that that's the best way to go about it is to follow the guidance of the CDC.
So no signage will be posted at city or county offices going forward?
I can check on signage. I'll check the city management in terms of what kind of signage is going to be posted. But again, since the beginning of this, we are following CDC guidance, and that's what we'll do with the events that are happening at the Alamo Dome.
And I think the same for the county, the Freeman, for example, in all county facilities. I know the county manager put out a memo late today that effective tomorrow, I think any signs mandating mask wearing at county facilities will be taken down.
But businesses can still ask customers, patrons, to wear a mask if they choose to.
Yeah, businesses are able to determine the health and safety protocols that they want to have in their own facility, as long as they're meeting minimum public health standards set by the city.
Those are all the questions we have tonight. Thank you.
Thank you.
Ready?